I have a friend, let's call her Donna, and she was telling me that she had a prescription for physical therapy, but she was afraid to go. She was afraid she might get hurt by overly aggressive treatment. She told me about a friend of hers who had gone to see somebody and had been so sore she hadn't been able to move for 3 days. A friend had recommended a physical therapy to her, but that friend liked aggressive treatment, and my friend Donna did not want aggressive treatment. Hello, I'm Deborah Quilter. I've written 2 books on repetitive strain injury, and I'm here to educate you about everything you need to know about having RSI. So getting back to my friend Donna, she felt she ought to go to physical therapy, but she just didn't know how to find somebody who would be right for her, somebody who wouldn't hurt her. She asked me for some advice, and I will tell you what I told her. But before I do, if any of my own personal physical therapists are watching right now, I'm not talking about you. I love you. You have been wonderful to me. Physical therapists have really helped me so much over the years, teaching me about repetitive strain injury, giving me great exercises, and becoming a partner in healing. And that's what I want everybody who's watching this video to find, is someone they can partner with. They can be your partner in so many ways, finding you the right exercises, doing a really great manual therapy, and just educating you about what you need to know. But getting back to Donna, she had a legitimate concern. She didn't want to hurt herself trying to get better. I have not only been a physical therapy patient, I have worked in physical therapy offices as a yoga teacher, an exercise professional, and a Feldenkrais practitioner. And I worked side by side with some of the best people you could find. They taught me a lot. So when Donna wanted to know what I thought, we had a little talk about it. And this is what I told her. I reassured her that this was a legitimate fear. I've heard of a lot of people who've gotten injured by physical therapists because the program was too aggressive or the wrong exercise, and their situation was made worse. There's a difference between strengthening and straining. So you really have to be careful about the kinds of exercises that you do. And a good therapist will know this. But not all physical therapists are created equal. So it can be hard to find a good one, and it can be very personal depending upon the therapist and the kind of treatment that you're giving, and also their personalities, how you mesh with them, how you feel about them. The right physical therapist can be a lifesaver, but the wrong one can set you back either through improper manual therapy or the wrong exercise program. In the case of repetitive strain injury, some therapists think because you're weak, you need to lift harder or heavier or pull on those exercise bands. And that's where we get into the strain instead of strengthening part of the equation. If you do lift heavy weights, you're further straining tissue that's already damaged, and it can make things considerably worse. So you don't want that. This can further weaken already strained tissue. I'm not saying you don't need strengthening exercises. You probably do, but where you need them is usually in the back rather than straining the ones on the distal end, which is the far end of your upper extremity. There are ways of adapting exercises so that you strengthen the muscles that you need to strengthen without straining. So how do you find somebody? A lot of times people will tell you that their physical therapist is the absolute greatest. But there's a problem in just taking that at face value. They may have had good results with that physical therapist, yes, but they also may just feel very loyal to that person because they like them. They've got a great personality. They're always welcoming and attentive. And maybe they haven't had a lot of broad exposure to many different techniques or modalities and many different physical therapists. So they have a very narrow frame of reference. And they assume that that person is really good, but maybe that's the only person they've ever seen. And maybe that person is good, but take it with a grain of salt. Your judgment will improve if you go to see several physical therapists. And I'm not necessarily recommend that you shop around like that, but sometimes physical therapists leave offices, so you have to see another colleague there, and it gives you a sense of how different they can be. It's more art than science sometimes. So it's really good to take these recommendations with a grain of salt. And furthermore, it doesn't matter if every other person in the world loves that physical therapist if you don't. Because in the end, yours is the only judgment that matters. You are the one who's experiencing the physical therapy, seeing whether it's getting you better or not, seeing whether you really resonate with this person. So trust your own judgment when it comes to choosing. Now, I'm also going to tell you a couple of things that you might not think about, but they might come up for you. So sometimes people will go to a physical therapy clinic and they'll feel a resonance toward one of the other therapists, and they'll want to go see that person because they, for whatever reason, like the person or they heard good things about them. And they might feel bad about switching therapists because they don't want to cheat on their physical therapist. But as one of mine told me, it's perfectly fine if you want to try another therapist in the clinic. Nobody's going to be offended. It's fine. And you can do that. Lots of patients do. The most important thing is that you are happy with the physical therapist that you're seeing and they're making progress or maintaining your progress. So when you're looking, I suggested that Donna go to the place that she was thinking about and just check it out. How's the vibe? I really like it when your PT is showing you the exercises, watching you do that. And so there's a continuity. A lot of places will have a physical therapy aide doing the exercises with you, but I personally like it when the PT is watching you themselves. Then you got to think about things like whether they take your insurance, and finally, where are they located? This is a point that one of my physical therapists made, because let's say you need to be seen 3 times a week in the beginning. It can be really hard if you have to drive for hours and hours to get to that appointment, and you might be tempted not to go because it's raining or snowing or it's just a far way away, or any number of things that could happen. It could be more trouble to get there, and you might be tempted to not go. And really, consistency matters. But if something's so far away that it's hard to get to, it will be another reason not to attend your physical therapy sessions. Your physical therapist will tell you how often they want to see you, and it's generally a good idea to follow through with their plan. Sometimes they want to see you more often in the beginning, and then they taper off as you improve. So you don't need to go quite as often. This is a partnership, and your physical therapist is checking in to see how you're doing. Usually when you come in, they want to know how you did from the last session. How did you feel? How's the exercise program? And then they can make adjustments based on what you say. Another thing you can do is you can check out the reviews. I'm always a little bit skeptical because, of course, sometimes people pay for reviews or they ask their friends to do that. But you can generally read between the lines a little bit. If it sounds like a genuine person with a genuine problem was helped by this particular therapist, and there's several different reviews with different body parts going on or different issues going on, that's usually a sign that it's a legitimate review. And it's something to consider. Maybe you want to go see that person. And then once you set up an appointment, how do you get along with that person? Are they paying attention to you? Do they check in to see how you're feeling? Do they ask you if it's too much pressure? That's the kind of thing that shows that they're really watching out for you, because they don't want to hurt you if they're a good physical therapist. Do they ask you how you felt after your last session? Do they explain what they're doing as they're going along so that you understand? Do they answer your questions in a way that makes sense to you? How do you feel after your session? And most of all, are you getting better? It's a good idea, if you like the physical therapist and think they know what they're doing, to give them a few tries, because you might feel sore after a session, but maybe you think that person really knows what they're doing, so you'll give them a few chances. It also may take some time for the modality that they're doing to start turning things around and for the tissues to start healing. So don't assume on just one session that you shouldn't go back unless you have a bad experience. And sometimes another thing happens. Maybe one physical therapist will actually refer you to one of their colleagues because they feel that that person has more experience or special training in the area that you need. So that's a really nice thing. That's a big plus if the physical therapists at that clinic are working together that way. That's happened to me, and it's been a wonderful experience. Now, how do you evaluate? If you're getting better, that's a really good sign. If you're not, or you seem to be backsliding, that also is a sign. So the other thing to be careful of are physical therapists who don't respect your limits. If you tell them something hurts and they don't back off or push you beyond your limits, if you've said you've had enough of those exercises, they should tell you to stop. I've had a lot of physical therapy in my years. I've had some of them insist on doing a certain set protocol no matter what was going on with me that day. And I have found that good physical therapists modify and adjust their treatments according to how you walk in that day. They're treating you at that moment. They're seeing how you respond to what they're doing and adjusting according to that. They might modify your exercise program, give you a different way. Most of them know dozens of exercises, dozens of ways of getting at the same muscle group. So if you can't do an exercise one way, very often they'll find another way and give you that until you find something that you can do without aggravation. I've also had some physical therapists who wouldn't stop when I told them that what they were doing was hurting me. And that's really not a good idea. One of them bruised my neck. There was a thumbprint on my neck after the treatment. Another one gave me exercises that exacerbated my problems. And I kept saying, I have a home program that I do every day that's really helpful. Can I just do those exercises? But that was not okay with this physical therapist. So basically, I left that practice. And then there's another thing I tell people, sort of the gut test. If you just feel uncomfortable with that person, that's enough reason not to see that person. There are many physical therapists in the world. So find one that you feel a kinship with, that you can partner with, because they are your partner in healing. You want to have a good relationship with them. You want to feel comfortable with them. So once you've found your great physical therapist, they are worth their weight in gold. So you do your part. Show up on time for your appointments. Do your home program. Do the things that they say that will help you. Communicate with them back and forth. And it is just a wonderful thing when you've got that partner in healing. So getting back to my friend Donna, we checked the reviews. She went to the place that was close to her house, 5 minutes away, that she resonated with. And I told her, look, if you're afraid, tell the PT, because then they'll know that you're afraid. You don't want to be hurt. So that's good information for them to have. And there's a happy outcome to this story. She found a great guy. She texted me to say that she had liked his manual therapy, that he found through exercise the place that was really weak that she needed to strengthen, and she had no idea. So he was educating her as well as helping her heal from her injury, and also explaining why he was focusing on the areas that he was focusing on. So she understood. Her PT said, let's start you off easy with the exercises. Amen. Because if you do more, then it could set you back, and you don't like the exercises because you hurt yourself. Whereas if you do under your maximum, you've done yourself a world of good because you've done the exercises, but you didn't go too far. You didn't overdo it. So less is more. If you're not up for it today, do what's comfortable and then stop so you won't be sore or sorry tomorrow. So Donna has 2 more appointments. We'll see how that goes, but I have a good feeling about her. And I'm really glad that she told me this so that I could create an episode to help you understand a little bit about choosing a good physical therapist. If you've had experiences with physical therapy that you want to talk about, drop them in the comments below, and be sure to watch the video that's coming up next for more great information about repetitive strain injury.